Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you to become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Reiter. Dr. Gladden, we just wrapped up with Dr. Cory Torgerson, who is a plastic surgeon and ED specialist in the Toronto area. And he has something he calls the big shot, which you sounded kind of like you thought it was a good thing for guys to consider doing.
It's an interesting approach. We're familiar with the P shot and the O shot and things like that are designed to kind of enhance clitoral function and sensation, and the same for men. He's got a different take on this, actually. It's almost like doing using a very natural substance, but actually increasing girth and length up to, pretty substantial gains, quite honestly, like a couple inches in girth and maybe 2 or 3 inches in resting length. I don't know about erect length, but so I think it's a fascinating conversation. We talk about the technology and the technique, but we also talked about sexual function and sexual performance, and we also talked about human sexuality in general. It's a really kind of somewhat broad-scoped conversation that leads into his technology. But I think everybody would enjoy listening to this. It's certainly entertaining, and it's certainly intriguing.
Entertaining indeed. We did laugh quite a bit on this one. So for listeners, if you're really interested in this one, please be sure to share with someone that you think may benefit from this show. And if you like what you hear, please click subscribe on your podcast app.
Yeah, we appreciate your positive reviews. That's such a big help to us. So if you like what we're doing, help us get the word out. We love it. Thanks so much. Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here on a beautiful cloudy day in Dallas where it's raining, chatting with Steve Reiter again. Steve, how you doing in sunny Colorado?
I'm doing really well. I've been following my AIM 7. On episode 204, we had Dr. Eric Koremam, and I've been following my AIM 7 exercise recommendations and also the morning routine recommendations. So we mentioned on an earlier podcast, morning sunlight. Yep. And today it was like, hit it hard on the weights. Today's a weights day, hit it hard. And so right after a recording earlier and before this, I did about 40 minutes on my tonal, hitting it hard, and jumped in the shower, and now we're on here.
Yeah, that's beautiful. Yeah, no, my routine was boosting oxytocin for about a half an hour and 45 minutes. And
how are you doing that?
Well, that comes down to the topic for the day, actually. So that's a teaser for this conversation we're about to have. So boosting my oxytocin and then jumping into a nice Vasper session. So good interval training. So good stuff. Well, with oxytocin in mind, we're going to introduce our guest today, Dr. Cory Torgerson, who's from Toronto. I don't know, it's probably cloudy up there. It usually is around the lakes, but probably not snowing yet. But Cory's here because he's a plastic surgeon, but he has a real interest and has developed real expertise in the area of men's sexual health and sexual performance. And it's a big topic. It's more than just erectile function, right? So, but we'll talk about all of it. And Cory, welcome to the program.
Hey, Dr. Jeffrey. Thank you. Thanks, Steve. I'm happy to be here.
Yeah, good. It's good to see you. So let me ask you this. Did you grow up knowing you wanted to be a sex therapist, or how does that work out?
I say it every day. It's just the weirdest thing how you got into this. But, I think probably like with most of us, as we get into our 40s and 50 and then, upwards of that, you just live life and you sort of take it as it comes. And as opportunities come or as you go through different things, you have that mindset. What's the problem and how do we fix it? And could somebody else be helped with this solution?
Yeah. So is this did your interest in this, was it a personal journey, or was it, you're doing plastics and things, but you're really focused on the face and neck and head, if I'm not mistaken. That's where some of your expertise and certifications are. But was there something, how did you actually get pulled into this arena?
Yeah, it was a personal journey, and it was sort of the beginning of my 40s. And, I was like, well, I'm not feeling great. My energy levels were down compared to usual. I was just tired. My sex drive wasn't the same. The erections weren't the same. Just kind of like, what's happening? And then, you do a little bit of research. You did some blood tests. Everything's normal, except my testosterone's low. And I'm like, what? So, and it sort of started that way. And it just sort of made sense to me that as we get a little bit older, guys kind of go through the same experiences in life. Women go through menopause, men go through andropause, and there is a lot of things that change as our hormones change. And what's the body of literature say about that? And how do we fix that? And I certainly have very straightforward pathways for women, but what about men? Men live in silence. And so it's really birthed out of that. And I thought it was personal for sure. I think usually the best things are.
Yeah. Oh, yeah. No, my own story is, kind of spurred me into what we're doing today in the whole longevity space, right? So I think it's actually good when things are personal because, you're speaking not from academic experience, you're actually speaking from real life experience. And so I think that gives everything a lot more power. But if you're listening to this, I think when you start to think about sexual function, and we've had, for men or women, quite honestly, but we've had other shows where we've talked about this, there are some aspects to this that are really kind of interesting. You kind of brought up the hormone piece of it. Do you want to talk a little bit more about the hormone piece? We can kind of work our way through a number of other ones as well.
Yeah, I mean, so, men generally, it can start in their 30s for sure, but I mean, our testicles poop out as we get older. We make less testosterone, and there are symptoms that go along with that. And the correlate is, menopausal symptoms in women. How do we treat bad symptoms in women? Well, we give them hormone replacement therapy. How do we treat andropause? And the reason is kind of twofold. Number one, we're not really taught about andropause in medical school. You know that. We're taught about menopause. Yeah. And so we don't really have a grid for it. Family doctors, even endocrinologists kind of go, I don't know. Let's test your testosterone. There's a range. Oh, you're in the range. Well, the range goes from friggin' 18 to 70. And what does that mean? And so it doesn't mean that the 70-year-olds don't have symptoms, because I can assure you they do. All right. So, there's risks with taking testosterone. Well, there's risks with doing everything in life. And so as long as we keep it in the normal parameters, I call it optimization. And there's a crazy amount of study that has gone on the last 10, 15 years that show if you can optimize a male's testosterone up to the high end of the normal range, which is normal, okay, it's associated with a ton of benefit, and that benefit can really change how you feel about yourself, how your mood is, how your sleep is, how your sex drive is, how your erections are. And there's longevity studies actually out there that say you live longer, and even cardiovascular benefit. So that's one of the things that happens as we get older as men is our hormones change, and what are we doing about it? And the fact that we're talking about this is the most exciting thing, because, for so many men, they are labeled by their family doctors very quickly. Oh, you're a testosterone junkie, you're a bodybuilder wannabe, you're pushing this and it's not safe. Yeah. And they really don't have a grid for talking about it because they haven't had the interest.
The men should understand there are a lot of T clinics that have popped up around the world, probably with holding out a testosterone vial, to inject, or a cream to put on as the answer to everything. And, in our experience, we've learned that it's actually a much more complex area of biology than just testosterone.
Well, there's no question about that. There's no question about that. I mean, it's one piece in a whole, ocean of variables to consider. But certainly it's a good place to start.
Yeah, no, absolutely. And I think, what we do at Gladden Longevity is basically look at full hormone panels in the blood for men. We're not just looking at testosterone total or even free testosterone, which is very important to know, what's the free testosterone that's actually acting in the cells, but getting all the other variables, sex hormone binding globulin, estrogen levels, estrone levels, DHT levels, dihydrotestosterone levels, prolactin levels for that matter. We look at everything, progesterone, estrogen, we look at everything to see where is somebody, because just so the audience knows, both men and women make estrogen from testosterone. And so men need estrogen and women need testosterone. And then how you metabolize your testosterone can be either a healthy way or a way that actually increases your risk for prostate issues. Or if you're a woman or a man, if you're processing your estrogen down the wrong pathways, you can increase the risk for breast cancer or prostate cancer, et cetera. So it's a very rich field in terms of its upside potential, but it also has to be played properly, looking at hormone metabolites and metabolite levels and the hormone levels themselves, and then optimizing the timing with which the hormones are taken and things like that. So don't just think, well, I heard that, I don't feel quite as good as a man. If I just get a testosterone shot, everything will be fine. That's kind of like saying, my car's not running right, I'm going to put air in the tires, everything should be fine. It's definitely rolling smoother. It's not that simple, right? You want to work with somebody. The point is you want to work with somebody that's a true pro that can actually keep you safe and keep you optimized.
I love that. That's such a good message. Perfect. Yeah.
Yeah. And then, there's a lot that goes into erectile function also. There's a big psychological component when it comes to sexuality too. And I think there can be for people, if they bump into an issue with erectile dysfunction, it leads to a sort of a lack of confidence, if you will, and which to me is kind of a lack of feeling safe, that they can trust that their body's going to perform. And so it sort of starts to set up a cycle in their psyche about not feeling safe going into this situation, which then perpetuates
the whole thing.
The ability, the whole thing.
Right? I think you make a good point in that there's so many psychological issues that are there with erectile dysfunction. Number one, when I'm seeing patients in my office that are in their 20s, you're like, is this really organic? Is this something? We know that 85% of all ED really is vascular, as you know.
Right.
There's lots of reasons why you can have it. 85% is vascular, so dealing with vascular issues. But a 20-year-old's probably not going to be vascular, if I was going to guess. And then, and so psychological is a big thing. Where do I usually start with that? I start with porn. To be perfectly honest with you, porn has never been more available than it has on the planet to 12-year-olds, to 8-year-olds. And it's like crack cocaine for their brains, and they get addicted to that instant hit. If they are, having sexual activity, self-sex or partners, not partnership, it's always self-sex. And so it perpetuates and potentiates these pathways that are not safe. They're not beneficial. They're not good for the doer or the person that is getting done to tell you the truth. And there's this big deficit and distance then between partners. It will never be the same. So I usually go there. I talk a lot about porn in my clinic. And then for what you say, it's true. Once that cycle happens, it just gets repetitive in their head. It's not going to happen. It's not going to happen. It's not going to happen. And then
it becomes a self-fulfilling
it's so
prophecy.
True.
I think it's great that you brought up the whole porn issue because it has become so ubiquitously available. And it wasn't that way when I was a kid growing up, right? There was a magazine here or a magazine there. They weren't in my house, but you kind of knew about them, sort of, kind of, I don't know. But now it's like, anything that you could describe, on planet Earth, anybody can get access to, it seems like. So, right, exactly. Right, exactly. So, but the point is that, it's a dopamine hit to see something that's titillating, let's call it that, exciting or excitatory. But sexuality itself is so much bigger than that, right? When you look at sort of some of the tantric sexual practices, right, coming out of India or the East or things like that, where people are actually using sexual activity not as an act of something that leads to climax, but actually as a form of communication and spiritual enhancement in the relationship, right? And out of that, orgasm may come, or may come multiple times, or may come for an hour. But it's not about that. It's about sort of that spiritual connection, that knowing and being known, loving and being loved, and kind of ascending into a new space, which dumps tons of oxytocin into your system, which, by the way, oxytocin is a magical longevity hormone. It does everything good for your immune system, for your biology, your brain, your blood vessels, your blood sugar, everything gets better with oxytocin. So it's interesting that we almost need to reframe the conversation around lovemaking, because it sort of depressurizes it also for people. So if someone is struggling with erectile issues, and there's so many things we can do to help people, quite honestly, we're getting ready to start a program here that's called How Hard Can It Be? And it's going to be men's sexual function, Gladden Longevity. And we're going to bring lots of different facets to bear, right? But the point is that if you can teach people to really enter into sexual activity, not with a focus on orgasm, but really with a focus on connection, and let it grow things organically out of that, all of a sudden people start to feel so much more safe in that space. And you don't even have to have an erection to have an amazing sexual experience, or you can have an erection for an hour and a half and have an amazing sexual experience, right? So, but it creates a different environment that's actually much healthier. And I think when you go to talk about porn, it basically slices out one sector of
that experience,
that experience, right? And tries to glorify that as if this is the be all and end all. So kids growing up don't really even know what true sexual intimacy is, right? They think it's an act.
Yeah, so it's really, really true, and I love that you're doing that. I read an interesting book lately, and it said that sex is a feast for a woman, and the men are invited.
Well, there you go. Well, actually, I feel like it's a feast for me too.
Well, I mean, but I mean, it's just how men and women approach it. It's so differently, and it is about communication, and that's exactly what porn takes away from that whole situation. And so,
that's right.
But again, I just love the fact that we're talking about this, and that people are able to hear about this, because there's so much dysfunction out there, and there's so much need out there.
That's right. So the other thing that it does is that men, if they are having erectile issues and they are watching porn or whatever, then they're feeling like they're really in this giant gap. Like, here's this guy that's obviously doing this for I don't know how long, and I'm struggling here. So then they start to feel inadequate, right, as a human being, etc. Now, the only good thing about that is that if people aren't satisfied with their erectile function, is that they actually seek help. Because it really is a canary in a coal mine, as you kind of intimated earlier in the conversation, in terms of vascular health. And so, we like that element too.
That's awesome.
Yeah. So tell us a little bit about this big shot that you're involved with.
Yeah. So, at our clinic, we think about it sort of the three main pillars of things that guys care about: drive, function, and form.
Mm-hmm.
And those are generally things that, are racing in our brains. Is it going to work? What does it look like? And do I feel like doing it? And so, from a male-centered sort of point of view, we deal with that. And so Big Shot really is about form. It's about size, and it's not particularly new. Every dude on the planet, in every culture, and every time in history, wouldn't mind a little longer and thicker. Doesn't mean if you're 3 inches, 6 inches, or 9 inches. We don't walk around with boners. We walk around with soft penises for the most part. And if it's a little cold or if we're a little anxious, or they're a little smaller. So it's not new. But what is new in general is how we do it and the safety behind it. And we don't want to mess up our junk. And so Big Shot really is something that we've patented. We've got trademark, and it is platelet-rich gel matrix. It's sort of the best of everything, mixing PRP, growth factors, with hyaluronic acid. And when you do that, it creates this very stable, very collagenous forming gel that not only is instant and safe and natural and reversible and predictable, but also super long lasting. We're talking like 3 to 4 years, maybe goes down about 10% per year. So it sort of beats everything else in terms of like fat.
This episode of the Gladden Longevity Podcast is brought to you by H2 Molecular Hydrogen in the Gladden Longevity Store.
Yeah, Steve, you've heard us talk about this numerous times on the podcast in terms of the benefits of H2 and hydrogen water. We love it. You know, it's really the best way to balance your entire redox system. So it really protects you from free radical damage. I take it every time I get on a flight to protect me from radiation damage when I'm flying. And I use it to rejuvenate my brain in the afternoon. You know, there's really two kinds of exercise. There's physical exercise, and taking H2 before or after that works great. But also there's mental exercise. And I find that the H2 will bring your brain back when you're tired in the afternoon. So I think it's like the perfect thing for longevity and for performance, quite honestly.
And I talked to you about this, that I found dropping 1 or 2 tablets in a glass of water right before bed. I've seen an overall bump in my deep sleep when I do so. And
fascinating. Yeah.
Yeah. So if you click on the store tab when you visit GladdenLongevityShop.com and use the promo code podcast10, you'll get 10% off your order. And this code isn't only good for our H2 product, but it's also good for all the supplements we carry. So podcast 10 at the GladdenLongevityShop.com.
Yeah, one of the other things that I use it for routinely is when I'm about to go on a mountain bike ride. And I will say this, that if I go on a long mountain bike ride, I will take one prior, I'll take one during, and I'll take one after. And some of the Ironmen that we've worked with have said that when they're doing an Ironman, they'll take it 3 or 4 times throughout the race. And their comment is that it's like taking out the old battery and putting in a new one. It really rejuvenates your body's ability to perform when you're doing more extended athletic activity. So think about that too. You know, if you want to go do a longer hike or whatever else, take it with you.
So GladdenLongevityShop.com, enter podcast 10 for 10% off your order.
H2 molecular hydrogen. It's low-hanging fruit on your quest to make 100 the new 30. So let me get this right. So, because I don't know a lot about this, that's one of the reasons I wanted to have you on the show. But I think, so you're doing an injection where at the base of the penis?
We do it throughout the penis. It's the shaft and the tip.
Okay.
You know, my experience with this is that I'm a key opinion leader for several injectable companies. I do a lot of injectables. I have a lot of experience with injectables and PRP. And so it was just sort of a natural sort of connection for enhancement, and something really that I was pretty shocked that there was this huge demand for. I mean, it made sense. In a way, it's the exact same thing as a breast implant for a woman. Like Dr. Jeffrey and Steve, when you think about it, adding a little volume to a woman's chest makes them feel more legitimate, more beautiful, whether they have their clothes on or whether they don't. It's not really about this, is it? It's about this. It's about how you feel about you're naked. And it's the same with the dude. We mostly walk around feeling not good enough. It's always contextual. You know, who are your brothers and your friends and who did you see and all that kind of stuff. But for the most part, you know, we walk around with incredible shame or not good enough. And those are crap emotions. You know, if you walk around feeling confident and secure in your shape, that's power. Like I always say, the gift of big shot isn't sex. It really isn't. The gift of the big shot, it's legitimacy, it's confidence. The gift of the big shot is feeling good in your naked, whether you're by yourself, you're in the shower in the gym, or you're in front of a partner. Like that's power. The word is cocksure.
So cocksure. Okay, there you go. Catchy phrase. So tell us how this actually works. So somebody comes into you and their complaint is, let's say that they don't have any issues with their shape or their size or any of that kind of stuff, and they're struggling with erectile dysfunction. That's their issue. And you kind of determine that it's not psychologically, they've got a great relationship. They've got, a loving partner and all this sort of thing. It really seems to be more physiological. So now you're going down a pathway of hormones and vascular evaluations and things like that. So that person's probably not even asking for the big shot. But then you've got somebody else maybe with a different profile, or you tell us.
I mean, you guys know in general in practices, it's just the same story after the same story after the same story, and so
Yeah.
there's patterns for sure. And so the big shot is generally the same thing. They've never felt good enough, or they've recently been in a breakup and they're starting new relationships, and or they just they've been teased and they just want to feel confident. They want to feel like they're okay. Most of them are okay with their erect length. In general, my best patients are the growers, not showers. And so, either it's a comment from a partner or it wasn't thick enough or long enough or good enough. It's always birthed out of pain, unfortunately. It's always birthed out of pain, but it's that. The ED piece can come along with that, but we deal with that simultaneously or sequentially or separately, but they all go together.
Okay. So then let's say somebody comes in and let's say they're a good candidate for this shot, and you're doing the other things around the area, not the physical area, but around the whole area of sexual performance and et cetera. Then somebody comes in and they get the shot, and you're doing the injections of the PRP and hyaluronic acid kind of up the shaft through the tip of the penis down the other side, probably the top to bottom. So it's volumetrically, you're adding volume to penis. It sounds like is what's happening. Is that correct?
Exactly true. It's filling up a potential space, so you get longer, thicker when you're soft, and you get bigger overall when you're hard. Most of the increase in size when you're erect is in girth, but there are some sort of increases in length as well from the shaft to the tip that we see when you're erected. So I just kind of call it bigger overall.
Okay, got it. I'm sure people that are listening to this are curious, well, how much are we talking about? Is it a function of how many injections you sign up for? I'm sure that's got to play a role. Or it may be that in somebody, because this is pretty elastic tissue, quite honestly, so you can probably take somebody that's pretty small and inject a fair amount and get them pretty much more than what they had. But I'm just curious, how much is that? I mean, what are we talking in terms of girth and length of that kind of thing?
I mean, first of all, it's non-surgical, which is cool. It takes me about a half an hour to do this, which is cool. It's instant. Right. You see it right away, and it's upgradable. And so we always start with something that looks extremely natural, that someone's not going to go, oh, it's too much, or the partner might say, oh, it's too much. You always want to start there, and that's always a good, safe place to start. But I mean, it's very much dependent upon the person of how much we can go. We can go in girth an inch up to 2+ more inches increase in girth.
Oh, wow.
Okay.
Wow. Okay.
Plus, and in length, a soft length I've seen up to 3 inches. It just depends on the person. It's so funny because you think that the dudes that are 7, 8 inches resting to begin with are going to be the ones that go, oh my gosh, look at this, but it's not. They're not the ones that are overwhelmed. It's the ones that are starting at 1 inch to 2 inch and go up to 3 or 4, and you've doubled, tripled, or quadrupled their penis size, and they can see it. Especially if they're a little bit heavy and they've got that suprapubic fat roll mounting around it. It's like dramatic. It's like you've changed their life. They're like a different person. All of a sudden they stand taller, and you've just given them that big shot of confidence. You've given them that big shot of value and legitimacy and all that kind of a thing. And so, does it help with sex? Yes. But is it like that big shot of feeling amazing about yourself and how that you approach your sexuality? Yes.
So then tell us the impact on erectile performance or ejaculation or things like that. There's an immediate change in your let's call it your resting girth and length. But then is it as easy to have an erection? Does it interfere with blood flow? Does it prolong erections? The
product goes underneath the skin and on top of the vascular sheath. So it's in that potential space. It doesn't change any, there's no change in sensitivity because all the receptors are in the skin. And so it also doesn't change your erectile ability because we're not injecting into vascular. In fact, we don't want to. That would be counterproductive. In fact, it would plug it up, right? It would be an occlusion.
Right.
So we
Exactly.
don't want that. So it just really fills in that space. So think about it. If you have an erection and then you have, something around that erectile sheath, and then you have skin on top of that, the skin's actually going to be tighter. You're actually going to have a harder, more firm penis when you're erect. This is true. So that's kind of cool. And then, that's kind of what it's about. I mean, if you're kind of a semi and you can happen, but the tighter the skin is, there's different feels that come along with that. So we do see an improvement, although it's not directly improving your erection. Makes sense.
Yeah.
We do other stuff for that.
Yeah, we've had conversations about that. We could maybe touch on that as well. But the shot is such a unique feature here. So let me ask you this. Are there any side effects to this? Or I would suspect that there could be, maybe, just because you can have a side effect to almost anything.
True story. So the complication risk and the complications and risks are low because, everything I like to be safe and natural. And so, this has really been birthed out of what's better than this. So sugar, hyaluronic acid, PRP, they're both dissolvable. You can, if you had an asymmetry, one complication, which is, probably about 25%. I do it in 2 sessions. I'm going to call this kind of penis art. The first one is the big fill. Make it as even as possible. But if there's some peronis, some bends, some lists, I like to let it settle. I like to see what it looks like. We come back a couple of weeks later, give it a good stretch, give it a really good. I'm really in the business of making a nice even tube that has a nice harmony and balance between tip and shaft. I know it sounds weird, but this is kind of what we're doing. We're just creating nice even tubes that look even from all the way around, and then we'll inject again. So asymmetry, we definitely will see that. We correct it if there is any on the second go. That's kind of innate. Getting into a blood vessel is something that we don't want to do. It's certainly in the realm of like less than 0.1% or something like this. The product is, dissolvable if you didn't like it, if there was an issue with it was too big or it was too much, or there was an asymmetry you didn't like, a nodule, you can inject hyaluronidase. It's going to dissolve the product within 10 minutes, or Kenalog if you had a nodule, if someone had a reaction to hyaluronic acid. So that's an easy fix. This is true. Having something terrible like a pulmonary embolism that you sometimes hear about, doctors injecting fat in places and it getting into blood and going up into the lungs. Never heard of, never seen, but theoretically, sure. Infection risk, less than 1%. PRP is antibacterial. It's healing factors. We use it to heal tissue. And so although we stick our penises in dirty places, and so I certainly...
Speak for yourself.
We certainly say no sex for a week, let everything heal up. They can masturbate if they want after a few days, but I give them antibiotics as a precaution. So there you go.
Okay. So I was thinking it must be kind of an art form, quite honestly, because you're injecting a product and you could end up with lumps and bumps and everything. So it's just, if you're listening to this, it sounds like it's a process is really what you're saying. It's not a come in and maybe you're perfect going out the door. It really is committing to a bit of a process, not a long process, but just understand that this is an art form and it's really sculpting.
This is so sculpting, and you want to have a pretty penis. You want to have it when it's soft, and you want to have it when it's hard. You do. You think you don't, sure. Dr. Jeffrey and Steve. You think you don't, but you actually want a pretty penis.
Well, I'm not going to get quite that personal, but let's just say, let's just leave it at that. Okay, so. Well, very, very cool. It's cool that you've done this, and so we've done some really nice shows on nitric oxide and the need for nitric oxide, nitrate-rich foods, improving erectile dysfunction. I will tell you this: that what we found also is that from the standpoint of vascular health, that the Mediterranean herbs are really magical here. Things like basil, summer savory, tarragon, rosemary, and even parsley. They're really, really good at improving dietary nitrate, which increases endogenous nitric oxide production. One of the other big takeaways we'll tell you that we've learned is that you want to stay away from fluoride toothpaste because the fluoride will kill off the bacteria in your mouth that are important for converting dietary nitrate to nitrite, which is critical for nitric oxide production. And using mouthwashes will destroy erectile function and also raise blood pressure, particularly if they have strong antibacterials in them. And that's a tip you could give your guys, is to stay away from mouthwashes, fluorinated water, fluorinated toothpaste. You'll see that helps.
I mean, these are awesome tips. I mean, I love the natural. I love the botanical. We're interested in getting into a skincare line it's very vegan and healthy, and I love that. It's amazing. But most of your approach, I understand right now, is sort of dealing on vascularity, increasing the dilatation of the blood vessels to get more blood into the penis. Is that right?
It starts hormonally, right, and vascularly kind of simultaneously. And then we also work into the psychological component, because we found that a lot of men have been traumatized in relationships, right? And maybe some of these men that have been not felt beautiful, let's say, or felt attractive, they've suffered trauma over that too, right? And so there can be psychological wounds there that people have to get over. And yes, looking better in the mirror is a step in the right direction, but helping people to kind of think that through and navigate that, I think, is important. And then I think really, talking to people about sex is so much more than an act that you do to have an orgasm. Really that whole idea of communication, really, to me, it's really a conversation between two people, right? You're speaking, and now you're speaking tactilely, right? And so it's very conversational. And so I don't know, just trying to help people expand into the space of really enjoying their sexuality without all of the porn-based expectations of performance can take you into another world. It can also enhance your performance, but it takes you to another world of intimacy and connectivity and oxytocin and all these wonderful things that, quite honestly, are immensely satisfying to both parties. So,
yeah, and I love that. It's very holistic. Do you guys do anything with sound, with shock waves?
Yeah, we do. We do pulse shock wave therapy. We have Gainswave here. We can do that. We've done that. We also use PRP, so we can do that.
You inject it into the vascular, yeah. Vascular,
yeah.
Yeah. We do that.
Yeah.
We use something here called Viasure. I don't know if you have that in your clinic, but it's an acoustic shock wave. I love the concept of that because it's a non-drug, and it actually stimulates angiogenesis and smooth muscle.
It does.
Yeah.
That's right. Yeah. TRT, pulse shockwave therapy, does the exact same thing. It's acoustic waves that are coming through. So you're not hearing a song being played, but it stimulates healing. We've done a nice podcast on that also. So it's a machine out of Germany that we use, pretty high-tech thing. So yeah, we like that. And then really optimizing blood vessel health, aerobic exercise is critical, right? Cardiovascular function, cholesterol levels to some extent, and then really kind of emphasizing ways to, not only increase nitric oxide by the things that you eat, but also certain supplements you can take that release nitric oxide into your system. An interesting thing is we do use some, Viagra, Cialis, things like that, but that's almost at the end of the road for us, because really those drugs don't work in a bunch of people because they don't have enough nitric oxide to save in the first place, right? They're basically blocking the degradation of nitric oxide. Well, if you don't have nitric oxide, who cares if you're blocking the degradation? Right. So you got to preload it on the front end. So we focus a lot on loading the front end and then seeing if somebody needs any help on the back end.
That's fascinating. That's fascinating. Yeah, but I love it. There's so many different roads that lead to Rome, but they all kind of get there eventually, and if you can optimize somebody in that way, you make such a significant impact on their lives, from the communication to the the backing off from the expectations of doing the act, to the optimization of your hormones, to the amazing.
Yeah, it's beautiful stuff. Steve?
Gents, all the time I see on social media ads for these testosterone herbs and testosterone supplements. Are there any supplements that you would recommend listeners that are thinking about trying the natural path to help get their testosterone levels up?
Go ahead. I mean, we've come across one that we're very fond of. There's quite a bit of data around now from company called Upgraded Labs, and Upgraded Tea is their formulation. And it works really nicely. In a matter of weeks, people boost testosterone levels. And it can be used in women too, right? Because women need testosterone also, right? So that's a kind of our go-to at this point in time. But it's a collection of different herbs, some tonkat ali and some magnesium, a few other things I can't rattle off the top of my head, but it seems to work quite nicely.
And certainly, my practice, I don't use the herbs, and it's for a variety of reasons. Number one, they absolutely work, and men that are on that, I'm like, I want to tightly titrate you to a proper number, and I need to be able to do this very, very predictably, and I can. And so I'm looking to get to a very specific value. And those that are taking lots of different things that generally say, like, we're just going to keep it clean, and we're gonna do it with something that you can get from the pharmacy that I know is safe. The problem with a lot of supplements, not all of them, but some of them, especially in Canada, is that you can slip them in for whatever country. They're not regulated. You don't know the purity. You don't know what they're laced with. You don't know the concentrations. And so there's all this blather that it's too many variables. And we're just going to keep it clean. And certainly it can work. But I haven't found a source that, like you, that I found to be consistent. And so I'm holistic. I'm a big believer in that. But when I'm treating someone, even the creams I stay away from, they're just so much hard to know the absorption ability. So we do injections twice a week. We try to keep it more physiological in that way. And to be able to do that, it's certainly a little bit more of a titrated approach, I'd say.
Yeah. If we're injecting, we do it twice a week typically. And then topical testosterone has its own issues, quite honestly, because you generate a lot more dihydrotestosterone when you basically process the testosterone through your skin. And so dihydrotestosterone will cause prostate enlargement. It does increase libido pretty nicely. Your libido doesn't come from testosterone. It really comes from dihydrotestosterone. So boosting that can be helpful, but it can also have issues with prostate, as I mentioned, and it's also associated with hair loss. So it's the DHT that's basically attacking the hair follicle. So, you have to kind of look at the whole picture here to do the right thing for the individual.
Dr. Jeffrey, is that why you have such a good sex practice and that you're bald?
They go hand in hand. No pun intended.
We do a lot of hair in our clinic here as well. I have a huge hair transplant business, and so we do lots of DHT talk as well. So you're right. Exactly. You're right on the mark.
Exactly. Well, this is one where I can talk about it, but I can't really show you the evidence for it.
Yeah, good. That's true. Yeah, DHT is a big hitter there as well. Yeah. So, especially for sex drive.
Cool. Well, Cory, it's really been a pleasure chatting with you about this. I think the audience has really learned some. I know I've learned a few things about the big shot and the cocksure. So I think that's an interesting thing you've come up with there.
Yeah. Well, thank you so much for the opportunity to be able to share it. It was awesome.
Yeah, beautiful. All right.
And for listeners that want to stick around and be an Age Hacker Plus subscriber, we're going to be talking with Dr. Cory and getting those 5 questions. Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to GladdenLongevityPodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.